are in listen-only mode.
Hello, everyone. My name is Kate Bailey, and I work with Minnesota Communities Caring for Children. I wanted to start this webinar off by thanking you for joining us. This is the 6th webinar in our spring series on resilience. We're so glad that you could join us today and hope that you will join us also for our final webinar, which is on June 25th. Today, we're fortunate to have Jared Brown and Rachel Teedy co-presenting about the relationship between sleep and trauma, and also how sleep plays a part in resilience. Jared and Rachel both work for Pathways Counseling Center in St. Paul, and also for the American Institute for the Advancement of Forensic Studies. Just a little breakdown of today's webinar. The webinar will be 1 hour in length, and there will be a little time at the end for any questions that you have. At the end, if you have questions, you can use a little raise your hand function on the webinar, or you can type your questions into the question box, really at any point throughout the webinar, and that's how we'll engage in a little Q&A. And it looks like Jared's going to start presenting the first half of the materials. So with that, I will turn things over to Jared.
Great. Thank you, Kate. Thank you, everyone, for taking your time out of your busy day to listen to our presentation today. We're going to talk about the topic of sleep and resiliency. Sleep is a complex topic that we have been researching and studying now for a number of years, Rachel and I, and we've given a number of presentations in the community, and we also teach courses at some of the local colleges on some of these related topics. And our goal today will be to share some of our professional experiences, our research findings with you and in the next hour. I believe all of you have the training objectives, or at least you've seen them. Our goal will be to cover all of these in a very brief and quick overview. My goal will be to cover the first two objectives, and Rachel will be covering the last two, the second half of this presentation. I always like to give a brief disclaimer to folks when we give a talk like this because it's pretty heavily medical focused, so I'll just read this quickly to all of you, but here's our disclaimer. Please consult with a qualified medical doctor or sleep specialist prior to the implementation of a sleep improvement program. The information in this presentation is neither a substitute nor a replacement for professional healthcare advice, diagnosis, or treatment. Consult a primary healthcare professional if further questions arise regarding sleep health. So the information today is just for informational purposes only. We can provide you some general feedback if you have some questions, and we'll probably present a few case studies along the way as well. Here's my bio. Feel free to read it on your own time if you'd like, but I am the treatment director at Pathways Counseling Center. We recently started a program for adults who have insomnia and mental health problems. I'm also the owner of the American Institute for the Advancement of Forensic Studies. We do continuing education trainings for criminal justice, mental health, social service professionals. And I'll be willing to share this PowerPoint with all of you after the fact. Feel free to email me anytime if you have questions about the PowerPoint or the topic of sleep in general. I also have a number of publications on the topic of sleep that I'll be more than happy to share with any of you. Rachel will probably share her bio with you a little bit more at the start of her presentation. So we have this broken up into part 1 and part 2. So basically part 1, I'm going to be covering kind of the introduction overview of sleep, some of the risk factors, consequences, and childhood trauma in relation to sleep problems. If we have enough time, I have a few slides in there on some special topics of discussion. If we don't, I'll still leave them in the PowerPoint for all of you to review on your own time. So I think it's important for us to define what we're really talking about. In the bulk of this presentation, when I talk about sleep disorders, is going to be related to insomnia. And the reason why we talk about insomnia is because it is the most prevalent sleep disorder that's out there. So this is basically the definition of insomnia from the Diagnostic and Statistical Manual of Mental Health Disorders, 5th edition. It's a subjective complaint of difficulty falling or staying asleep or poor quality of sleep. So I think we all know that, but it's important to kind of define this early on. This is the Diagnostic and Statistical Manual. It is a fantastic resource even for non-mental health professionals. I recommend anyone working within any type of helping field to just have this manual at their discretion. There's a lot of great information in there, and the two main complaints that are mentioned in this manual related to insomnia are difficulty maintaining sleep and difficulty falling asleep. Needless to say, there are a multitude of reasons why this happens, and I'll try to cover some of them in just a few minutes in the PowerPoint. I thought it would be interesting just to do a basic calculation of how much time we actually sleep in our lifetime. And if we were to live to the age of 75, and on average we sleep 8 hours per night, that's about 1/3 of our life, so 25 years. And if you were to equate that into actual days of sleep, we are sleeping a little over 9,000 days in our lifetime. So sleep is a huge component of everyday life, and we'll talk about why I believe that sleep is the bedrock of overall health. I even put higher premium on sleep than exercise and nutrition, but those are very important as well. I thought it'd be interesting just to do a quick word search in the DSM-5 on how many times these common phrases are mentioned. So I looked at sleep, anxiety, insomnia, depression, autism, ADHD, trauma, post-traumatic stress disorder, resilience, and resiliency, and take a look at how many times these words were mentioned in there. Don't know what this means other than that book. It mentions sleep more than any one of these other types of keywords you may hear about often in your line of work. And take a look at the word resilience. The word resilience was mentioned 9 times, and the word resiliency in the DSM-5 was mentioned 0 times. So just something to think about. This is basic information. All of you know this, but I think it's important for us to be reminded that appropriate and significant sleep, adequate sleep, is foundational to how we operate on a day-to-day basis, how our emotions are regulated, how our cognition, attention, and just overall psychosocial development. On the flip side of that, if we're not getting adequate sleep, obviously these domains are impacted in sometimes dramatic ways, which can trickle down to how we interact with our loved ones, how we maintain employment, how we learn, how we process memory. So this is some very important stuff. Couple interesting facts. The next slides, next 3 or 4 slides, I'll talk about just a few key facts I'd like all of you to keep in mind. As of right now, there are a little over 100 different sleep disorders that are out there in the literature, in the manuals. I do not know all 100. Again, our focus today is on insomnia. Some of you may have heard the term parasomnias. Those are sleep disorders that happen typically when someone is in a sleep state or waking up or transitioning to sleep, where they're more odd behaviors, they're unusual. Sometimes they can be discomforting. Sometimes it can be even dangerous for the spouse, the children, or the individual. And today we won't have time to talk about that too much, but I would recommend all of you just to have a basic idea of parasomnia, especially people who are working in child protection arenas. There have been cases where people who have a parasomnia will abuse their children, will abuse their spouse, will walk down the steps and fall and break a bone, but they do not know that they did that typically because they're still asleep, which makes it an unusual type of scenario if you do come in contact with. 2 resources on the bottom of this slide, the National Sleep Foundation and American Academy of Sleep Medicine. They have wonderful websites with tons of resources. I would recommend all of you checking out. They have just a wealth of information, and they're free of charge. Another interesting fact, there are 2 main stages of sleep. And the first stage is non-REM sleep. That's non-rapid eye movement. And this part of sleep is actually divided into 4 different stages. And if you can see the chart here, it's broken up by stage 1, 2, 3, and 4. Once we move to stage 5, that's rapid eye movement. And this would require a whole day of training just to go through these different steps, but this chart's on here once you get the copy of it. It just breaks it down to the percentages of how long people typically spend in each of those stages of sleep. And keep in mind, people do not always go in and enter stage 1, 2, 3, 4, and 5. It'll sometimes bounce around, and people will cycle through these stages multiple times in the evening through a sleep cycle. Another interesting fact that a lot of people don't consider is the relationship of snoring and sleep problems. Around 90 million American adults do snore sometimes on a regular basis, but more chronic type of snoring is impacted in around 37 million Americans. And the reason why it's important to be aware of snoring, this could indicate that the individual is dealing with some severe types of sleep problems, maybe sleep apnea, not always necessary. But if you are encountering a child or a spouse or a client who has chronic snoring problems, it might be a good idea to get that person into a sleep specialist for a sleep study, because what you'll see in the research is kids who chronically snore are more likely to be diagnosed with ADHD, have attention problems, behavioral problems, and in a lot of these cases, after snoring has been corrected and addressed by a qualified healthcare professional, a lot of those problems will go away or be minimized. This, I believe Rachel will talk a little bit about this in her PowerPoint, but just something to keep in mind, newborns typically require around 14 to 17 hours of sleep per day. Typically, as we get older, we need less sleep, but everyone is so individualized in how much sleep they need. So for example, somebody who gets 8 hours of sleep a night may not function at their optimum level because maybe they need 9 hours a night. And on the flip side of that, there are some people that can function just fine who sleep 6 to 7 hours a night. So it's very individualized. I am not going to read all these word for word, but these are just a couple key facts to keep in mind. But we're not alone. Most people in their lifetime are going to experience some sort of sleep complaints or discomfort. In fact, around 75% of adults experience at least one sleep complaint on a weekly basis. Needless to say, if somebody is dealing with chronic sleep problems, the rate of mental health, anxiety, depression, worry, fear goes up. And what you'll see is a high percentage of people who have mental health problems such as depression, anxiety, or bipolar also have comorbid insomnia. And the reason why I thought it would be a good idea to start a sleep program where I work full-time is because the overwhelming majority of clients coming into our center, regardless of what their mental health diagnosis was, were also dealing with insomnia. And that also goes toward people with substance use problems, brain injuries, trauma, attachment issues. Insomnia is one of those symptoms that you see amongst many of these mental health conditions. And there's a lot of research out there to support the fact if you can treat and address the insomnia, a lot of those mental health symptoms will be diminished, and maybe treatment will be more effective for somebody that's coming in and dealing with substance use issues. So, and another thing to keep in mind is when someone has impaired sleep, so often their executive functioning is impaired. And when I talk about executive functioning, that is people that have difficulty relating cause and effect. They sometimes have difficulty anticipating future consequences. They make poor decisions. So people who are chronically sleep deprived sometimes have problems making good decisions. A few additional thoughts. I just thought yesterday it'd probably be good just to put some of my personal thoughts and experiences with this. I've worked with a lot of clients in a lot of capacities, from clinical to forensic type of work. And there is no doubt in my mind that when people have chronic sleep problems, it hijacks them emotionally and physically in so many areas. I also believe it's a multi-generational problem. So often when the child has sleep problems, the parent has sleep problems, and when the parent has sleep problems, the child has sleep problems. So one exacerbates the other, and it just keeps fueling the fire. I have seen this, I've read this tons of times, I've talked to many experts in the sleep community. It's clear from my standpoint, if you can treat sleep problems and really address them, problematic behaviors, symptoms will go down in some of these other areas, and you're going to have more improved outcomes. I use the word sleep boundaries too. I'll talk to some clients about that. I've seen this countless times too. I've talked to enough professionals. I've watched tons of webinars on some of these topics. And some of the professionals who've been doing this longer than I've been alive talk about a good night's sleep begins in the morning when somebody wakes up. So for example, if you wake up in the morning and throughout that whole day you're using technology and you're eating high amounts of sugar and using caffeine and tobacco products and under chronic stress, the time you get to bedtime you're going to be wound up, and it's going to be very difficult to relax and really get into a sleep-light state. If you do fall asleep so often, it will impair your whole night's sleep, and you'll wake up many times through the night and then wake up in the morning, not feel refreshed, start the cycle over again because you're tired, you need more caffeine, you need more sugar, but it just keeps fueling this cycle. So it's important to teach people to have boundaries around limiting these things. And as far as I'm concerned, limiting and eliminating some of these will make sleep better. By no means, if you eliminate all of these, it will cure sleep problems because there's so many reasons why sleep problems happen. But more times than not, you're going to see it improve. And if I had it my way, I would recommend every state agency, federal agency, nonprofit agency that works with criminal justice populations, mental health, social service, child protection, substance use programs, integrating components of sleep education and sleep hygiene practices into teaching the clients they work with, because again, so often these clients come in and they're chronically sleep deprived, and it's difficult for them to stay awake in a group setting. Criminal justice settings, they may forget to show up to court, they're confused. If you can get a handle on their sleep, you're going to see better outcomes for everyone. Dangers of sleep, don't need to get into this a lot, I think most of you know, but it is a huge problem in America. Many people say it's an epidemic. It can be hazardous to one's health, well-being, and the public. These are some of the disorders you'll see in the DSM-5 where insomnia is actually one of the symptoms associated with it. I won't go through all these, but again, major depression, bipolar, any type of drug that someone's withdrawing from, typically it's going to disrupt their sleep cycle. Again, sleep problems are multifaceted. It can happen for a variety of reasons. Environmental, if there's family conflict, you live in a neighborhood where there's tons of things going on and loud noises, school setting where their kids going, if they're getting bullied and teased, they come home, that can disrupt sleep. Psychological components, again, depression, anxiety, fear, worry, panic attacks. There's biological components to this. People who are dealing with obesity, diabetes, pain disorders, and a number of other medical health conditions often experience insomnia. Again, sleep-related disturbances can be difficulty falling asleep, staying asleep. You'll see this bedtime resistance with some children. This may be an indication that they have a fear of the dark. If there are kids that have had trauma exposure, sometimes you'll see this with kids who have been adopted and there's adjustment disorders or attachment problems. They may have a lot of resistance to bedtime. Some people you'll talk to as well will indicate that they don't like going to sleep because it makes them tired. They go to sleep, they wake up even more tired. That could be an indication that possibly they're dealing with sleep apnea. I don't want to say with certainty because I'd recommend a sleep study, but that could be one risk factor. A ton of medical health conditions associated with insomnia. Again, any type of medical health condition that causes pain or discomfort or breathing issues will typically disrupt breathing. A high percentage of people with traumatic brain injuries experience sleep problems. If you're in a criminal justice setting, in a child protection setting, you're dealing with kids who experience pediatric abusive head trauma from child abuse. Typically, they're going to experience some insomnia, which can disrupt recovery and make things even more exacerbated. Ton of mental health conditions. I've published articles on ADHD and sleep, autism and sleep, fetal alcohol spectrum disorders and sleep. So if any of you would like copies of those, please shoot me an email. Overwhelming majority of people with FASD, ADHD, and autism also deal with sleep problems. Again, that could be a full day's discussion, those topics alone, but those articles I wrote have a number of just key facts, warning signs, and strategies to be aware of. Multitude of risk factors. Again, this is a good handout, a couple pages I have here. Once you receive it, feel free to review in detail. If you have questions about why some of these might relate to insomnia or cause insomnia, shoot me an email. I'll be more than happy to answer it. Again, anything that causes stress, discomfort, pain, worry, emotional sorrow can disrupt sleep. People going through divorce typically have much more severe problems with sleep compared to people who are in a relationship that they enjoy, they are stable in. Sleep can also become disrupted as people age. You'll see people with hormonal changes and imbalances that can cause insomnia, heart disease, and so on. A few more risk factors to be aware of: tobacco products, alcohol use can disrupt sleep, and I'll talk a little bit about alcohol use in a few minutes. Needless to say, consequences of poor sleep are vast. It can impact relationships. There's some evidence that people who deal with chronic insomnia are more likely to become violent, abusive. There's been a handful of studies done on insomnia and domestic violence and insomnia and child abuse. It can impact performance at work, in school, and the stat down below related to auto accidents, around 1,500 people a year die in the United States as a direct result of people driving fatigued or tired. I've done a lot of work with problem gambling. We have a problem gambling program at Pathways. I've worked with enough clients who go to the casino all night, go home, drive, fall asleep. One of them crashed, got really hurt. So just many variables and complexities to that, and around 100,000 motor vehicle accidents that do not result in death are a direct result of driver fatigue. This slide's kind of interesting. I did a little research a while ago for another presentation, but these are major events in our history where they believe insufficient sleep directly or indirectly caused some of these accidents. 3 Mile Island, grounding of XL Valdez, the Space Shuttle Challenger. You'll hear medical related accidents where maybe they do surgery on the wrong leg or arm. Just lots of errors, so you'll see that constantly. So it's so important to teach professionals too the importance of sleep. A few more consequences of sleep. It can impact the way you communicate with people. Some people can feel indifferent, so people who are more socially outward, if they're chronically sleep deprived, they may come off as indifferent. It can definitely increase risk of suicidal tendencies and behaviors. And take a look at the first two. If someone goes without sleep for one night, typically it will reduce cognitive performance by around 25%. If you go 2 nights, it could be up to 40%. So this is serious stuff. A lot of consequences here. This list I collected from just many trainings I've attended, talking to tons of clients, interviewing professionals. These are just some of the more bigger ones you'll see. Please take a look on your own time. Again, shoot me an email if you have some questions about specifics. I have a couple full pages of just the consequences in inadequate sleep. Some important reminders I want to talk to you about it as well is that when kids have reduced sleep, poor hygiene practices when it's related to falling and staying asleep, they are at a greater risk of developing psychiatric disorders compared to adolescents who can maintain normal sleep practices. Those of you that are working in the juvenile justice arenas or child protection, there are a handful of studies out there. There's not a lot, but there is some emerging evidence to indicate that a number of juvenile individuals who become involved in the criminal justice system are also dealing with insufficient sleep. And when you treat the insufficient sleep, their delinquent behaviors go down. I actually have an article coming out next week on trauma, conduct disorder, and insomnia, and it goes through all the literature and talks about these facets. So it's so important when you're working with criminal justice involved clients to treat their sleep problems, because it will help hopefully reduce their criminality and tendency to become involved in the criminal justice system in the future. A couple other things to be aware of. I think I mentioned this before, but again, keep snoring in the back burner for all of you. I would recommend reading more about this. Kids who snore are twice as likely to develop attention and hyperactivity problems. Hence, they might get diagnosed inaccurately with ADHD and subsequently be medicated for ADHD. And when you address the snoring, the attention and hyperactivity problems may go away. Again, people who snore can also have ADHD, but it's important to rule out the two. And keep in mind here that insufficient sleep has also been linked to obesity problems. Children who slept fewer than 12 hours per day are twice as likely to be overweight at the age of 3. So this has long-lasting consequences. So getting newborns on a regular sleep schedule and really teaching those boundaries and consistent habits with sleep and maintaining a consistent sleep schedule 7 days a week will be crucial to their emotional and physical development. In the chart below here, depending on what site you go to, what research study, these are the recommended hours an infant, a toddler, a preschooler, and a school-age child should get in sleep. Tons of other considerations to take into account when we're talking about adolescent sleep problems. I won't have time to go through all these today, but I did list here some of them and then the reference where I found them from. A few other things to keep in mind when you're dealing with childhood sleep issues is oftentimes children who are chronically sleep deprived are going to have adjustment issues. Their self-esteem is going to be impacted, and they're going to have more behavioral problems. And unfortunately, in my experience, I teach a graduate level course with Rachel at a local college on sleep to school teachers, and so often school teachers are not trained in sleep disorders, or at least to be aware of them. So it's important to teach teachers, if a kid is behavioral in their classroom, it may not be ADHD. They may just be chronically sleep deprived. If you're seeing inconsistencies in test scores, where 1 minute they're doing great, the next minute they're doing horrible, it could be an indication of erratic sleep patterns. Again, never 100%, but it is something to be aware of. Important reminders again, why are we talking about this topic? It's crucial to development. If children are not sleeping, all of these areas are going to be impacted. Communication, concentration, self-help abilities, and it will most likely impact the way they learn, and then they carry these behaviors on into adulthood. The next section I'll briefly go through because of time, childhood trauma. These are some of the things related to childhood trauma. I'm assuming most of you have had some training in trauma. But one of the key symptoms you'll see after any type of traumatic event is poor sleeping habits. It is one of the biggest symptoms that most professionals, caregivers will see after a child's exposed to a traumatic event is sleep problems. And this relates back to the ACEs research, which ACEs clearly shows, there have been a few studies on this, that children who have experienced adverse childhood experiences are more likely to have sleep problems in adulthood, including a host of other medical and psychological deficits. One stat to be aware of is 70 to 87% of people with post-traumatic stress disorder do report some type of sleep disruption. So it is crucial when people are treating trauma to simultaneously treat insufficient sleep. A few other things to be aware of I just listed out here is the impact of sleep and on trauma. It's a vicious cycle because if people aren't sleeping good, they're dealing with untreated trauma, they might be more likely to abuse tobacco, alcohol, and drugs, which may help them fall asleep, but it prevents them typically from getting into the deep sleep, and then they wake up feeling unrefreshed, and that cycle starts over and over and over again. Here's a slide on the ACEs research. This came from one particular study I went through. Just same things we've talked about. I laid it out here just to keep in mind. There's some evidence that kids who experience sexual trauma and develop PTSD will have even more severe forms of sleep problems compared to other forms of trauma. When you see the term sleep latency, it's just a fancy term used in the medical and professional community. It just means how long did it take for that person to fall asleep. When you see the word sleep efficiency, do they sleep through the night? Do they toss and turn? Do they wake up? Do they wake up refreshed? And then this nocturnal activity, sometimes caregivers may see this with children who've been abused. Increased rates of sleepwalking, maybe. They will toss and turn. Maybe they're crying in their sleep. They wake up constantly. Just things to be aware of. And needless to say, children who are affected by domestic violence, intimate partner violence, will experience a host of consequences. One of the main ones will be sleep problems. And when you have sleep problems, all of these other areas may be more pronounced. Special topics of discussion. I'm already over on time. There's some slides on here on sleep and juvenile delinquency, sleep and adoption, and sleep and traumatic brain injuries. You'll have to read them on your own time. And thank you everyone for your time. I'm going to pass it over to Rachel now.
Thank you, Jared. Very informative.
Thank you.
And I just lost the PowerPoint. Jared, I'm sorry, everybody, but I think, Jared, you're going to have to do the PowerPoint for me.
Okay.
I am Rachel Teedy, and I work for Pathways Counseling Center with Jared. I also do work with him in APHIS, doing forensic presentations, and I also teach some college courses through the graduate program at Concordia University. And I'm very sorry, Jared, but it's gone.
I can see it on my end.
Kate?
Jared, it looks like you're the presenter, but we're not seeing the PowerPoint yet. I'm not sure if you've got to accept that you're the presenter.
Is there a button I'm supposed to click for that?
Let me try to pass it back to you again. Hold on.
Thank you. While they're going to find that, I'll just talk for a little bit about the importance of my presentation, what I'm talking about. Jared shared some really great stuff about the dangers of improper sleep and what we're kind of doing to ourselves as a society that does not value sleep and rest, and we're all so overly scheduled and busy. But what we have, I'm sorry?
Can you see the screen now?
No.
Okay.
This is Kate. Rachel, it looks like it's waiting for you to click. Is there a pop-up?
Show my screen. Show my screen?
Yep, I think so. And then we can switch it back to Jared here.
I did click that.
Okay, Jared, I've made you the presenter again. Maybe something popped up for you.
It says show my screen.
Yep, so try clicking that. There we go.
Wonderful.
All right, sorry about that, everyone.
I'm up and running. So Jared, yes, my apologies, absolutely. Jared, if you wouldn't mind just forwarding through the slides for me, I would greatly appreciate that.
Yes, no problem.
All right, so I'm also going to talk about some really practical interventions because when we are talking about sleep issues, people often believe that it's kind of part of life and there's not much we can do about it, where really there is. There are alternatives, there is medication, and there are also other alternatives to help improve the quality of sleep. Just to start with defining resilience, what is it? An ability to recover or adjust easily to misfortune or change. We all have struggles and we all have unfortunate things in our life, but how quickly can we bounce back? And what helps us bounce back? And some of the research I'm going to show you helps demonstrate that sleep is one of those factors. From a professional, it's the brain's restorative vacation that occurs every night. It's a break, a way to get away from the stress, the anxiety, whatever's happening in the individual's life, and a chance for the brain to get to reset. It can do several different things according to another professional. Make you feel ready to take on the world again. Protect against mental health, improve performance. Jared talked about the reduced cognitive functioning when we're not sleeping. Sleeping helps us think better, able to manage the day better, and also feel more healthy and have less of a need for caffeine, sugar, and other substances. Another professional said it's key to resiliency. We want our brains to be able to function well. This lack of sleep can lead to suicidal ideation, and sadly there are several studies that demonstrate that fact. When someone's not getting sleep, suicidal ideation can be increased. One study looked at prisoners of war from the Vietnam War, and they looked at them just a couple years ago, so 37 years after the war. And these individuals went through a severe trauma. They were a prisoner of war, and they did find that the ones that were more resilient were sleeping better than the others. So a very key study to show that sleep really can aid in resiliency. Treating patients with insomnia and PTSD, we can reduce the nightmares and the traumatic stress. I believe a lot of the people we work with and people we know think sleep doesn't impact their mental health much, but science is showing us that's not true. It's playing an absolutely huge role. And there's a correlation between positive affect and adequate sleep. It makes us feel happier throughout the day if we're getting the appropriate amount of sleep. Here's a few benefits to proper sleep. Our immune functioning, our metabolism, memory. You can read through the whole list, but there's a lot of benefits for ourselves physically and emotionally if we get proper sleep. What do we do about it? What happens if we're noticing that we're having a sleep issue or if we know somebody who's having a sleep issue? Talk to a professional and go to a professional who's familiar with sleep issues. If you're working with a therapist, make sure the therapist knows about sleep issues. Otherwise, that might not be being addressed. Go to a nutritionalist. There's lots of different things in our diets today that could be impacting the way we sleep. And if we go see a nutritionist, we could talk about some of those problems and maybe find an underlying condition we weren't aware of. Also, when you're looking at medications, talk to a doctor. A lot of people find them very effective, especially until they get into more of a regular routine to being able to fall asleep more naturally. So with all of these things, talk to professionals that know what they're doing. Another quote for you guys. I'll let you read through that. So when we're talking to somebody and we're trying to figure out what's going on and how their sleep is impacting things, let's talk to them. How many hours are you sleeping each night? I think if we asked everyone here right now, the answers would range a great deal. 6, 8 maybe for a lot of people. Does this vary from weekend to weekday? We find that the best way to get proper sleep is a structured routine that stays pretty similar day to day. Do you have trouble falling asleep? Why? Is it racing thoughts? Physical discomfort? Maybe an environment that's not suitable to sleep? How long has this been going on? And you can read through the rest. Do you wake up gasping, talking about medical issues, potential sleep apnea? And we can move on. Do you feel good when you wake up in the morning? Some people say, you know, I sleep 8 hours, but I wake up and I just feel exhausted. Well, then what's going on with that individual that's making those 8 hours not restful? Are they falling asleep throughout the day? Are they napping a lot? Do they stay awake through long things like a movie? If I turned off the lights and had you fall asleep right now, how long would it take you? I've talked to individuals that would be asleep before the door even closed and other individuals that'll lay there for hours. How is your brain functioning? How is your mood? Maybe the individual doesn't think their sleep is impacting their day, but it might be impacting more than they know. With any of these disorders, the diagnosis is key. Making sure we're talking to a medical professional and a mental health professional, finding out what's going on. Is it a medical concern? Then we're not going to be able to address that through some of these until we get the medical part taken care of. Go for a home visit. I do in-home work with people, and I'm very surprised sometimes at the environment. And you can see so much more when you're with them in their home than when they come to their office. They might be telling you that the house is clean, or that they're in a quiet place where they can sleep, and then you go in the home and you can see that that's just not true. Social factors, economic factors, all of these come into play a big role when we're getting the proper diagnosis. An entire sleep history, when did it start? Did it just start a year ago? Well, what changed in their life a year ago that wasn't there before? Or has this been going on their whole life? You can read through the rest. We're looking for co-occurring medical disorders. Psychiatric or developmental issues, again, looking at the history. Has this been that way since they were a baby, or did it start when they were an older child or an adult? Issues at home or school, do they have a peaceful environment? Are they worried about something? Are they experiencing a lot of trauma? And again, ruling out some of these medical issues. Bedtime routine. When we're talking about ways to improve sleep, to build this resiliency, a routine is a huge one. Hot baths or a shower, something to calm the muscles and calm the mind. Lavender scents, warm water. Give your child and yourself time to relax and unwind. Sometimes we're on our phone or we're watching TV until the moment we want to fall asleep. Well, that's tricking our brain into thinking that it wants to stay awake because of the light. We need some downtime to relax and get ready for bed. Avoid, again, video games and television before bed. Sometimes children, especially children with special needs, picture cards can be really beneficial. Use some picture cards to show them, first we're going to wash our face, then we're going to get on our pajamas and go through the list like that. Exercise daily. Exercise is very important. We wear the body out so that it is tired and ready to go to bed. However, we don't want to do it too close to bed because then we have endorphins and our heart rate's up, making it harder to fall asleep at night. Find fun things to do during the day. So often clients I work with don't have a lot to do during the day, so they're sitting at home a lot watching TV. Well, they're not wearing themselves out. They're not stimulating themselves throughout the day, so then they're napping during the day and not able to fall asleep at night, and that sleep-wake cycle gets dysregulated. Reduce evening commitments. I know a lot of parents out there, I'm one of them. Sometimes you have baseball till 8 o'clock at night. Well, they're young kids and they need to get their sleep, and the activity can be disrupting that. So making sure you're looking at your commitments, knowing your child and knowing yourself. Is this going to impact the way I sleep? Is this a healthy choice for me? Keep an eye on stressful things prior to bedtime. If it's something that creates stress, raises adrenaline, it's something that maybe shouldn't be done at night. Reduce high conflict whenever possible and stress from your daily life. And then start the process early. You don't want to feel rushed. You want to gently get yourself or your child ready for bed slowly. Avoid napping after 3. If we want to go to bed at a decent time at night, naps after 3 can create a lack of tired feeling come nighttime, so then again the sleep-wake cycle stays dysregulated. Large meals and shaming and blaming can be other things that are detrimental to a routine. Ensure the bedroom is dark and comfortable. Bright lights, busy patterns, bold colors can create sensory overload. Again, especially in children and also children with special needs. I've talked to a lot of people who say Christmas lights provide just that right amount of light without giving them too much light, or some kind of night light that's very dim so that they have something to feel safe and secure, but it's not too bright in there. Minimize furniture. You want a lack of distractions, a lack of wanting to do other things. Calm, relaxing environment. If the child is afraid, lots of people will fill a spray bottle with water or maybe even scent the water, and then they can spray it like a monster spray to get rid of whatever they're afraid of at night. A designated stuffed animal or a blanket, something that helps them feel protected. Soft music and even weighted blankets have been found to be very helpful. I'll let you read through some more of these. Lavender fragrance, again, has been found to be very helpful. Establish a bedtime routine that's regular. Make sure they know that at 7:30 we're going to start brushing our teeth, and then by 8 o'clock we're going to be reading books. So they know what to expect. It creates less fights and it helps the body adjust more naturally. Play with your child. Stay busy during the day. Don't watch TV up until bed. Avoid yelling. One of the worst things at bed is stress. And I understand it. Parents get frustrated with, I'm not tired, I'm not ready to go to bed yet. Well, these distractions can create friction in the house, and then friction is going to raise the stress level, making it more difficult for the child to fall asleep. Make sure their room is comfortable. Allow them to talk openly about their feelings. Hey, what's going on? Why is it hard for you to sleep? Are you thinking about something? Is your bed not comfortable? Create an open discussion where they're not afraid to talk to you about what's going on. And moving on. Thank you. Here's a list of items to avoid. I'll let you read through some of that, but one of them you'll see is family conflict. Hard to avoid at times, but fighting, yelling, abuse, domestic violence, stress, all of these things in the household are going to impact everyone in the household with their mood and their physical functioning, especially when it comes to sleep. We want to feel safe and we want to be able to be calm when we're trying to go to bed, and family conflict can make that very difficult. Going to bed hungry, feeling unsafe, being distracted with too many toys, cigarette smoke in the house, all of that can impact sleep. One of the biggest things is explore new ideas and approaches that may help. You might think, I've tried that, it's not going to work. Well, maybe this time it will work. Maybe it'll be a little different. Maybe something that worked for one child is going to work for the other or is not going to work for the other. Be committed and intentional. Sometimes we want to try something new, so we'll say, I'm going to try the lavender spray, and then we try it for a couple days, and then we give up. Stay committed. Keep trying it for a while. It could change things. Search for information and new ideas. Identify the barriers. Am I drinking too much caffeine? Is there traffic noise? Should I get a white noise machine? Should I play some soft music? Maintain a family sleep journal. You know what, this night everybody slept really well. Well, what was different that night? Go back and take a look so you can monitor what works and what's not working. And as we're all doing here today, strive to achieve a deeper understanding of sleep health. Here's some specific techniques that you can try. Progressive relaxation and guided imagery. If you're not comfortable doing that on your own, there are some wonderful CDs, or probably apps too, that will walk you through that so that you could hear the calming music and hear the voice helping you relax. Massage, reflexology, yoga, all these things to incorporate the mind and the body. Counting your breathing. Several studies on how that can be helpful. We're slowing things down with intentional breath. Self-soothing techniques. Find out what works for you. What makes you feel better and calmer? What works for your child? Being mindful about it. Paying attention to, it's 4 o'clock, maybe I shouldn't have that cup of coffee. Or I know that it helps when I start the music at 7:30, so being mindful to try that. Art and exercise are other things that can be helpful. Cognitive behavioral therapy for insomnia. is one final program that I'm going to go through, and it has been found to be helpful in reducing anxiety, depression, and physical pain symptoms directly through sleep. We're going to focus on changing the false beliefs and attitudes about sleep. For example, a lot of us might think, I need 8 hours of sleep or I'm not going to be able to function, or there's no way I'll ever be able to sleep appropriately. We get this negative self-talk going when it comes to sleep, and that can be really detrimental because then we're laying there staring at the alarm clock, recycling these negative thoughts in our brains. Another aspect of cognitive behavioral therapy for insomnia, no pets in the bedroom. That's a difficult one for a lot of people because we love to sleep with our pets. However, when you talk to people, they do talk about how the pets will keep them up at night. Again, the caffeine after 4, keeping the bedroom cool. One of the big components I feel to this program is no watching the bedroom clock. If we're laying there and we're staring at the clock, we're keeping those negative thoughts flowing, and it's really detrimental to the process. No smoking or nicotine use or no exercise before bed. So the basic component is if my body is saying you can only sleep 5 hours at night, and I'm telling myself I have to sleep 8 hours and I'm building my anxiety over it, start by just sleeping for 5 hours. Get yourself to bed and up at a time that your body's telling you is okay. Then we're going to slowly improve that through time. Then start by adding half an hour on the front end. Then add another half hour at the back end. Rather than staring at the clock thinking I have to sleep 8 hours, we're going to gradually work our body up to that. After our sleep efficacy reaches 90%, the time in bed can be increased by 15 minutes every week. So again, that slow build. Go to bed only when sleepy. I work with a lot of people who have a bedroom and that's their only living space. So they're sleeping, eating, watching TV, hanging out with their friends in the bed. Sometimes it's out of our control, but when it is in our control, the bed can be a stimulus to tell the brain, I'm tired. And so we're only there when we're tired. And again, using the bedroom only for sleep and sex gives our brain that cue that this isn't where I'm going to lay and watch TV for hours. Go to another room if you can't fall asleep within 15 to 20 minutes. If you're laying there and it's not working, maybe take a little walk down the hall or read a book for a few minutes. Do something else to distract yourself for a while. And read or engage in other quiet activities when you get back to bed. And we've left the last few minutes. We have about 4 minutes or 6 minutes left for questions from you guys.
And again, right now you can feel free to type any questions that you have in the questions box. I'm not seeing any questions yet. You can also raise your hand if you'd like to speak, and I can unmute you. That's another option. Okay, here's a question for Jared. She is wondering about referral information for your sleep study program at Pathways.
We don't have a sleep study program. We focus more on the mental health side component of it, so more of the cognitive behavioral therapy for insomnia. A sleep study would take place typically at a hospital or clinic setting where there would be a medical doctor and medical health staff. Pathways were mental health staff. If someone is interested in referring to our program, feel free to just send me an email, or my cell phone number is 651-734-5517, and I'd be more than happy to talk with you about our program and possibly the person you'd be interested in referring to us and if it'd be a good fit for your client.
Are there any other questions?
Any other questions, Kate?
I'm not seeing any others. Oh, I'm seeing, is it true that you can't really make up sleep that you've missed?
That's what the experts say, yeah. I've read and talked to plenty of people, so let's say you go through the week and you sleep 5 hours a night. Some people think you can, once the weekend comes, you can sleep 12, 14 hours a day to make that up. But from what science is stating, you can't typically make up that sleep debt. Obviously, getting on a regular routine, if it starts on the weekend and you start getting more sleep, that might be a good first step. But make sure to carry that on into the weekday. But again, our society and just the way people are just very busy nowadays, and kids and commitments, going to school, jobs, it's a miracle if someone gets the recommended amount of sleep. It's very hard. You have to be intentional. There are some professionals and some groups that are really pushing for schools to start a little later in the day. And there is some research coming out that schools that start later in the day, typically the students in those schools have better performance, are less likely to call in sick than schools that start early in the morning. So if a student gets an extra hour of sleep, it can make a huge difference on the way they learn and the way they perform in school and attendance. So it'd definitely be worth a variable to consider.
And Jared, I would just add to that, that study does also show improved mental health. The students had just a self-report of feeling happier and just feeling better throughout the day.
Excellent point. Thanks, Rachel.
Thank you.
There was another question about what your thoughts were about sleep aids, if they're good or bad.
What are my thoughts about sleep aids?
Right.
I lost you, Kate.
Yep, it was just a general question kind of about what your thoughts were on sleep aids.
Yeah, my personal thought, and I am not a doctor, but I think some sleep aids, I have seen clients become dependent on them and overuse them, and eventually they stop working properly, or they continue to have to take more to get that same effect. There's some research on melatonin for kids and individuals. Depending on what study you read, there's some good effects to it. There's no effects. So if you are considering taking melatonin for yourself or your child, I would just highly recommend consulting with a medical doctor on those areas. And one thing to keep in mind, Rachel talked about cognitive behavioral therapy for insomnia. I believe that should be used in all types of settings because the side effects associated with that are little to none, and the benefits are huge if done successfully, and it can have similar benefits to medications and have less side effects. So just another variable to keep in mind.
Thank you, Jared. I would just add one more thing to that. With the sleep aids too, a lot of the individuals I work with, Jared talked about trauma, and if there's a specific trauma or something going on right now that's impacting the sleep and the individual's unable to sleep, then talking to a doctor might be a good thing to just see if there's, melatonin or something else that will help get them through this period. But then adding to what Jared said, reducing lifelong dependency and reducing that need for more continual through time.
Great point.
And this is Kate again, and it looks like that's all the questions, and we're at 1 o'clock. So I just want to reiterate, because it was one of the questions that someone had, that we will share these PowerPoints and the contact info for both Jared and Rachel. So thank you so much for joining us, and we'll get that information out to you later today.
Thank you, everyone,
Thank
for the
you.
opportunity to talk to you today.
Thank you.
Thanks. Bye-bye.
Bye.